the trust you have for your own doctor has been destroyed. Okay, I've seen this myself. And I think the answer is we need the individual people. This is what patients can do, regular people. Ask your doctor the questions. What's the data? I mean, I've seen many times, not personally, but people in my family have asked their doctor when recommended to get the COVID booster, what's the data? And the doctor doesn't know the data. And so doctors need to up their game. It's sort of an interesting thing. Doctors have, uniquely so, almost blind trust by the public. We have had that relationship for decades in this country, partly out of respect, but also because that's, sort of esoteric knowledge, complicated knowledge. Patients trust doctors. A doctor could get a patient to do almost anything. This is the truth. I mean, I've been in patient care for 25 years before I went into public policy. And so that's a burden of massive ethical responsibility. You have blind trust here coming your way. So when patients ask the question, the answer is not to spew out the recommendation. The answer is to show them the information, show them the data. When the doctor doesn't know the data, they're insecure because they're normal human beings too. And so I think that's something patients should do. They should ask the direct question, why should I take that vaccine? I just got out of a clinic visit for something trivial in Palo Alto Medical Foundation the other day, and they have mandated masks in the hospital. I didn't sit there and ask people because I know the data on masks. It's absurd. But I feel saddened when I see all these doctors walk around with masks on. So we need to call them out directly, ask them the questions. And for that trust, they have to earn that trust now. They've squandered that trust by just saying things that were not really scientifically correct. So this is something a regular person could do. You ask your doctor the question.
I love that. It's such a great piece of advice. Just, ask the questions, ask for the data, and take the power back so that we have a better understanding and hold the doctors accountable so that they go and hold their leadership accountable.
Exactly.